Hello, and thank you for joining me. My name is Dr. Edgar Tay from the Asian Heart and Vascular Center. And today I'm delighted to talk to you about treating diseases within the heart. And specifically, we're going to listen to a talk about valve disease. So I want to just introduce to you this concept of what valves are in the heart. Many of you may have heard about artery blockages as the most common condition, but I will tell you that over the next few years, you will see a lot of patients with a different type of heart disease that's going to become quite common, and these are valve disease. So let me just introduce to you what valve disease is all about. So heart valve disease is actually under the umbrella of heart disease, and you know that heart disease is pretty serious because it can cause poor outcomes in many patients. So what is valve disease? This is something that is gathering a lot more interest in the last few years because of new treatments. So if you look at the heart in a bit more detail, you will see that within the heart, there are these four structures. These are the valves of the heart, and they control the flow in and out of the heart. So they're very important structures because if they are damaged, then the flow control is abnormal. I'm going to show you this important video, which will actually show us what happens to a normal heart valve in the early stage of a person's illness, and over time, how this heart valve problem can become an issue for the patient. So if you look at this heart valve, you will see that as the heart pumps in a healthy heart, blood will flow out from the heart into this red structure called the aorta. So with every contraction of the heart, blood is then pumped through this valve, and that supplies the brain. But over time, wear and tear can occur, and you can see that calcium formation and hardening of the valves occur. And over time, you can see that the valves cannot open very smoothly anymore. And this is what we call aortic stenosis, or narrowing of the heart valves. So there are actually several types of heart valve disease. And if you look at the pictures that I've shown you here, the first set of valve on top left that I'm pointing to has 3 leaflets, and I show you 1, 2, and 3. This is a normal person's heart valve. In a patient who has abnormal heart valves, you can see that the patient sometimes has only 2 leaflets instead of 3. So on the right, you see this picture labeled 1 and 2. These are the 2 leaflet valves. And this is quite common. It's found in about 1 in 100 of us. So in a group of 100 people, one of them will have what we call a bicuspid aortic valve or 2 leaflet heart valve. In some other people, they might have had an infection in the past before. And when an infection of the valve occurs, hardening of the valve can occur at the edges, leaving a very restricted and small opening, which makes it very hard for the heart to pump blood out through the aortic valve. And the picture on the right, this is a classic condition where over time, because of wear and tear, calcium formation will occur on the valve leaflets. And you can see these round structures. These are actually calcium nodules, and they actually make the valve very hard and stiff. So because of that, they cannot open. And because they are very stiff, they lead to patients having a lot of problems with shortness of breath and pain. So if you look at this chart, it tells us when heart valve disease usually affects patients. And you can see that there are 3 blue arrows at the bottom of this graph. The first one is occurring somewhere between the 40 to 50 year age. Second highest incidence in the 50s to 60. And then the most common kind of aortic valve disease, which is the wear and tear type, tends to occur in the older age group, around the 70s. So over time, you see different types of aortic valve disease, but they all can result in poor outcomes for patients if they're left untreated. So this comes to the important point for most patients to identify what are the symptoms of severe heart valve disease. So the first most common symptom is what we call fatigue or lack of energy. So as you know, if the heart cannot pump blood out of the heart easily because the valve is obstructing the flow, patient then tends to get tired easily. If the patient walks a little bit more, he can feel short of breath. Sometimes as the condition gets worse, the shortness of breath can even occur while the patient is sleeping or lying in bed. And other patients may present or show up with symptoms of chest pain. As you can see in this picture, a man clutching his chest because there's not enough blood flow coming out of the heart. If you look at the condition of the heart valve disease from these three pictures, the left, you can see a very early stage narrowing. In the early stages, when the valve is a little bit stiff, the valve is still able to open. Patients usually don't have much symptoms. But as you go to stage 2, which is the moderate phase, the valve becomes more narrow and the heart is pumping harder to allow blood to come out of the heart. And you wait till stage 3, where the valve opening is so small and so stiff now, the patient is going to have a lot of symptoms and the heart is starting to fail. So why are we concerned about this condition? Is because it's becoming common. And in fact, a lot of these patients can be treated. If they are left untreated, it means the patient has severe aortic valve narrowing or stenosis, and you leave them alone, what will then happen is that the outcomes are very poor. In fact, if you compare patients with this heart valve condition compared to various types of cancers, the survival prospects is much worse if it's left untreated. So it's very important to identify patients with heart valve disease. So this question about how easy is it to pick up such kind of heart valve disease is actually quite simple. The first time most patients will ever hear of this condition is when the doctor listens to the patient's heart, and then they can identify a unique sound, what we call a murmur. If they hear this sound, they will have to suspect that the patient has heart valve disease. I put a picture of this seagull here because some of the murmurs or the sounds that we hear generated by these small valves are very interesting, and some even have called it a seagull sound, the sound that this bird makes. But in order for us to diagnose this even more accurately and scientifically, we use technology. And these very simple tools called echocardiogram allows us to see the valves very clearly, and is very easily done just external to the chest. We put some gel and we can see the insides of the heart. We can see the valves very clearly. In fact, with the recent technology advances, we can do what is called three-dimensional echocardiograms. And this allows us to reconstruct the valve anatomy very clearly. Remember, I showed you the 4 pictures earlier on different types of valves. With the three-dimensional imaging, you can see exactly that these patients have these types of heart valves immediately. And this is done with the patient fully awake without any invasive process. We can also see the heart function. Remember, I told you the heart is struggling to pump blood. Sometimes the heart may fail, and we can measure the pressures within the heart chambers. All these can be done very quickly in a 25 to 30-minute period. So this is a very simple but easy test to diagnose aortic valve disease. We have also moved on, other than echo, to do certain types of imaging called CT scans. These CT scans can look at the valve in very clear three-dimensional imaging, and you can measure the valve size very accurately and look for calcium as well on these valves. So echo first, and then sometimes CT scan as well. So what do we do if the patient has very mild or early disease in the picture on the left? And so in this situation, the patient is pretty well still. All he needs is monitoring. So every year or two, the patient will require an echo scan to see whether the heart valve has progressed from a mild situation to a medium situation. In the medium or moderate situation, as you see in the picture on the middle, again, these patients are becoming more and more symptomatic. They may start to develop some symptoms, so we have to watch them more carefully. So they may have to be followed up a little bit closer, perhaps 6 monthly to 1 year. And when they move on or progress to the third stage, which is the severe aortic valve stenosis stage, then you know that these patients really need to be treated. And if you don't treat them early enough, then I've shown you the pictures earlier on that the outcomes can be worse than cancer. What is also important is that patients with aortic valve stenosis are at increased risk of something bad happening during a physical activity. So if a patient has aortic stenosis or aortic valve disease, we have to limit some of them in terms of what exercise they can do. So if you look at this chart, there are 2 components, the static component and the dynamic components, and the various type of exercises out there that patients are doing. So if the patient has very mild aortic stenosis, then of course, most of these exercise he would still be able to do. But if the patient has medium degree or moderate degree of aortic stenosis, then we can only limit them to less activities, generally activities that are less aggressive, which are drawn for you in this yellow box. And if the patient has very severe symptoms or aortic stenosis that is now severe, then we really have to limit them to very, very little activity, because too much physical activity may predispose them to have danger or sudden cardiac event during the exercise. So now, how can we treat patients who have developed severe aortic stenosis? So the valve is now very narrow and the patient has very much symptoms. How can we treat these patients? So there are two main concepts of treatment. The old concept, or the more traditional concept, is cutting it out and removing the obstruction. That is surgery. But the more interesting, newer concept is actually to push the valve narrowing away and put a new stent in the center. So two broad concepts for us to treat these patients. So classically, you have this condition called aortic stenosis, and it can be treated by surgical aortic valve replacement, or it can be treated now with this procedure called TAVI, which is transcatheter aortic valve implantation. And the third box, I put it in black, because nowadays we don't recommend this third box anymore, because we know that medications cannot be used to treat aortic stenosis. So it's either surgery or TAVI. So remember, TAVI started almost about 20 years already. This year, we're celebrating the 20th anniversary of this procedure. But really, a lot of patients have started being treated only in the last 10 years. And this is started off in the early years of open heart surgery. And then the surgeons became more clever at making smaller incisions. But now with TAVI, it can be done very simply through the thigh artery by putting a tube from the patient's groin without having to open up the chest. The patient is done under local anesthesia and perhaps some light sedation, and the patient doesn't need even to have general anesthesia. So it's a big progress from 20 years ago to today. You can see a significant improvement in the the accessibility and the ease of the operation. So again, the first two pictures reflect SAVR, and the two pictures on the right reflect TAVI. So I'll show you what surgery is all about. So the conventional way of how the heart surgeons operated in the past was that if they want to treat the valve, they'll open the breastbone, the center part, open up the rib cage so that they can see the heart. Then they have to give the patient cardioplegia to stop the heart from beating and put the patient on a heart-lung machine. After that, the surgeons will cut out the narrowed heart valve. You can see the scissors here. And then they will sew in a new heart valve, and the patient will then have a brand new operated heart valve. And this picture on the right is essentially what the patient's chest wall will look like after a successful surgery. So you see a scar, and you see some chest tube scars here. So effectively, surgery here, you can see the chest is open and the new valve is being replaced. This is the surgical valve, or what we call SAVR. Today, I want to focus about this new treatment option called TAVI, which is a lot more easy for patients. And nowadays, a lot of patients are choosing this technique because it's much easier and less invasive. So I'll show you a video of what this procedure actually looks like. So we actually, from the patient's thigh, we push in this catheter. This tube contains the valve, and the valve is actually compressed onto a balloon. We take the valve across all the way to the narrowed heart valve. And here you can see we are putting the stent now very near where the narrowed heart valve is. Now, of course, we have to make some adjustments to make sure it's perfect. And the idea is to expand the balloon and open the new stent and valve. So here you can see we're adjusting. You can see the old valves. And here you see when the balloon goes out, the new stent is open. We push away the heart valve, the old ones, and then we can remove the delivery system as well as the wire, and finally the new valve is in place. And then the tubes are then removed out of the patient. So what you're left with is a new heart valve, a new functioning heart valve. So you can see, compared to the open chest wound, the final wound of a TAVI procedure is an 8mm little injection on the right thigh, compared to a big operation in the past. So much less invasive procedure. So what are the so-called pros and cons? So we know now that TAVI, if we do it versus open heart surgery, has slightly lower risk of mortality, shorter hospital stay, patients can return to work faster, they are less likely to have complications of irregular heartbeats, they have much less bleeding, and have much less pain from the procedure. So because of these 6 reasons, many patients have started to choose TAVI as a choice, a first choice whenever they have aortic stenosis. However, TAVI compared to surgery may have still some issues of mild leaking, need for re-intervention, and need for pacemaker, but these problems are also getting less over time. And because of the favorable features of TAVI, you can see that if you look at all the types of surgery and TAVI over the last few years, you can see the growth of TAVI is increasing significantly from 2012 to 2019. And you can see that patients who are choosing open heart surgery has fallen. This black line has fallen over time. So most people with aortic stenosis are now choosing a less invasive procedure. So I'd like to conclude here that aortic valve stenosis is a very serious condition, and the rates increase with age. So as we get older, we must be more aware there is such a condition. We cannot leave aortic valve stenosis untreated, because I've shown you that this is a very serious condition. It causes patients to have symptoms, but worse still, if you do not treat it, the survival aspects are going to be a problem. That means patients are less likely to survive over time. The last thing is that now there is a less invasive option to treat patients. There is now TAVI, and TAVI allows us to treat this heart valve condition without having to open the patient's chest. So with this, thank you very much for your attention.